Throughout the COVID-19 pandemic, we saw an explosion in people reaching out.
Eating disorders have been widely misunderstood, undertreated, misdiagnosed.
If the only knowledge people have about eating disorders are associated with the myths and stereotypes, people who believe they might be struggling will continue to have a difficult time opening up about their experiences.
There's nothing shameful about an illness that you didn't choose to have.
I mean, societally, we have a lot of embarrassment, I think, around bodies and also the way that we eat.
We live in these environments that, that sort of foster hating yourself.
There's a lot of factors, beyond just food and eating and saying, just eat.
It can be really invalidating when people say, it's just the eating disorder.
In the moment, it felt isolating.
Eating disorders affect every part of your life.
So eating disorders.
Eating disorder.
Eating disorder.
Eating disorder.
My name is Emily Donahue. I use she, her pronouns, and I am a community engagement facilitator and a direct client support worker at an organization called the National Eating Disorder Information Center. My role there involves a little bit of prevention and a little bit of support work. So as a community engagement facilitator, I get to go out into the community and speak to students, ranging all the way from elementary school to post-secondary, and members of healthcare organizations, to raise awareness around eating disorders, body image, disordered eating concerns, with the goal of prevention and building capacity. And then I'm also on the other end of our helpline and live chat. That's where my direct client support role comes into play. And so I'm speaking to folks either affected directly or indirectly by eating disorders and disordered eating, helping them navigate their journey, offering in the moment support, and sharing resources.
My name is Shivani. I work at the National Eating Disorders Association, and my title is Senior Associate of Resources. So I help with updating our listings on our website, and I also help with updating just general information whenever we need to on our website as well. So eating disorders are serious mental and physical illnesses that can potentially be fatal.
An eating disorder can sort of be categorized as like a really intense preoccupation with food, weight, and body. It can manifest in multiple different ways, which is kind of where we see those different eating disorder diagnoses.
So the first one I would say, so anorexia is an eating disorder characterized by weight loss, having difficulties maintaining an appropriate weight for the individual's height, age, and stature. And for many individuals, they would also struggle with a distorted body image. So people with anorexia, they typically restrict their calorie intake and the types of food that they eat, but people can also participate in other disordered habits, such as compulsively exercising, purging. They may also binge eat as well. And it's important to note because one of the criteria for anorexia on the DSM is being underweight. So it's important to note that you can't really tell what eating disorder someone's struggling with by how they look. So there is something called atypical anorexia that includes individuals who meet the criteria for anorexia, but they're not underweight despite the significant weight loss that they experience. And so research does show that there's no difference between the impacts of anorexia and atypical anorexia. The next one, I would say bulimia nervosa. So it's categorized by a cycle of binge eating and compensatory behaviors in order to prevent weight gain. So those compensatory behaviors can be self-induced vomiting, misusing laxatives, using diuretics, and other medications, fasting, or excessive exercise. Next is binge eating disorder. So binge eating disorder is characterized by recurrent episodes of binge eating, so eating larger amounts of food in a discrete period of time than most people in most situations. The the behaviors associated with binge eating are like eating really rapidly, eating past the point of feeling full, eating when they're not hungry, and eating alone. And oftentimes binge eating is coupled with some intense feelings of like loss of control, feeling shame and guilt as well. ARFID, so avoidant restrictive food intake disorder, is a new diagnosis in the DSM-5. So people that have ARFID limit the volume or the variety of foods that they consume. But unlike other eating disorders, the food avoidance or restriction is often not related to fears of being fat or not liking their body shape, size, or weight. So people with ARFID, they have like selective eating that's motivated by a lack of interest in eating food, or like food depending on like their sensory sensitivity. For example, like having strong reactions to the taste, the texture, the smell of foods, or like fear of aversive consequences. So fear of choking or vomiting when they eat. And then OSFED, so that's other specified feeding or eating disorders. This was previously known as EDNOS in previous DSM editions. So the category was developed to kind of encompass individuals who don't meet the strict diagnostic criteria for anorexia, bulimia, or binge eating, but they still have a significant eating disorder. So more recent research has found that OSFED is like the most common eating disorder, and research also kind of shows the severity of OSFED as well, showing that it's just as severe as other eating disorders. So one study found that individuals with OSFED are just as likely to die as a result of their eating disorder, much like people that have anorexia, bulimia, or binge eating. So pica is an eating disorder that involves eating items that are not typically thought of as food, and don't like have significant nutritional value, such as hair, dirt, and paint chips. Orthorexia is not an official eating disorder diagnosis in the DSM, but it's definitely a concern that's been on the rise. So orthorexia is a term that was coined in 1997, and it basically means an obsession with proper eating or healthful eating. Although being like aware and concerned of the nutritional quality of food you eat isn't necessarily a problem in and of itself, but people with orthorexia, they become fixated on so-called healthy eating, that they actually damage their own well-being and experience the health consequences, such as like malnutrition, or like impairment of social functioning, I would say.
I'm Sarah Dalrymple. I'm one of the registered social workers at BANA in the outpatient program. And I am a graduate from the University of Windsor psychology program, as well as the Wayne State University social work master's program. I've been with BANA actually for just about 6 years now, specializing in eating disorders. So BANA is the Bulimia Anorexia Nervosa Association, and we've been around since 1983. We actually started by a group of concerned parents at the University of Windsor, an information kind of let's support each other group. And from there, ground up, it gained funding, and we ended up becoming a non-for-profit agency that works on specializing in the treatment of eating disorders and health promotion. So we have a health promotion team that will go into the community and educate and increase awareness on eating disorders. And then we have a clinical team that will treat eating disorders in Windsor, Essex. Well, eating disorders are quite misunderstood. One thing that most people don't know about eating disorders is that restriction and dieting are identified as one of the largest causes of eating disorders. So they're one factor that societally we really highlight, and we go, way to go, pushing back on your hunger and weight loss and restriction and cutting back on your fun foods. Like, we reward this behavior, but it's actually quite damaging for folks in the eating disorder field, because that actually might be causing their concerns. So I think that's something that society, I would love to see, learn a little bit more about and be more aware of generally, is the fact that dieting and restriction are a major part of the disorder rather than the solution.
Anyone can develop an eating disorder. They are as diverse as the people that they affect. I think our media often pushes this narrative of eating disorders are a young, thin white woman's illness, and that's just not the case.
So my name is Sam. I am the vice president of the Recovered Project.
So the Recover Project is a teen and young adult-led nonprofit organization, and we have a goal of raising awareness about eating disorders and helping people in recovery. I am 21 years old, going to university in my fourth year for both English and psychology. I'm not really sure what I want to do afterwards. Something potentially in journalism or like traveling journalism, maybe. In a perfect ideal world, I'd love to write my own book one day, but we'll see how that goes. I just think some people don't realize that there's no certain look to an eating disorder. There's no certain size, age, color, weight. Like anybody can struggle with one, and it's also not always anorexia or bulimia. I feel like those are very common known ones. There's so many different kinds of eating disorders that I don't even think people are aware of.
So they're not something that you can easily spot and, point out and go, oh, that person has an eating disorder clearly just based off of their appearance, right? They come in all shapes and sizes, all genders, all races.
In the US, it's estimated that like 9% of the population, so about like 28.8 million Americans, will struggle with an eating disorder in their lifetime. And though anyone can struggle with an eating disorder, we do recognize that there are certain communities that have particular vulnerabilities in terms of like risk factors. So for example, athletes are at increased risk because of like the emphasis on appearance and weight. People with autism are also at increased risk of developing like pica and ARFID because of the sensory concerns.
We know that people of color are equally as likely to develop an eating disorder. We know that 2S LGBTQ plus folks are 5 times more likely to develop an eating disorder than their heterosexual and cisgender peers. Folks with disabilities or who are neurodivergent are just as likely to experience eating disorders. And so eating disorders don't have just one look. It doesn't affect just one type of person. And I think the narrative that we're being pushed by the media can prevent people from getting help because either they don't see themselves in that narrative and so they're not comfortable reaching out for help or asking for help. They're not recognizing themselves within it, or because doctors and medical professionals aren't asking the questions to those people. They're not screening them for their relationship with food and body. And so people just aren't able to get help.
LGBTQI folks are also at like increased risk due to like different risk factors such as discrimination, bullying, unrealistic body ideals within their community, and also trauma that they face from the violence and rejection from their identities. Men are also faced with an unrealistic body ideal. For them, it's being lean and muscular. For Black, Indigenous people of color, they're at increased risk due to trauma from the racism that they experience, and also acculturation. So acculturation is when people assimilate to Western culture. And then older adults are also at risk because of different life-changing events that they experience. For example, like going through a divorce, pregnancy, death of a loved one, and also signs of aging. So we know that stressors in life can definitely put someone at risk for developing an eating disorder.
Anyone of any body size can have an eating disorder. In fact, a low percentage of folks that do have eating disorders actually are underweight.
You can't tell whether someone is struggling with an eating disorder. And if someone does have an eating disorder, you can't tell the type of eating disorder that they're struggling with just based on their appearance. And kind of imposing those stereotypes can often leave people kind of questioning their own experiences and kind of feeling ashamed about like reaching out and feeling dismissed when they're with what they're dealing with. So I would say it's super important that we educate people to kind of help break down these barriers so people can, open up about what they're going through and get the help that they need.
Compared to pre-COVID-19 and even still now, we're seeing a huge increase in the amount of people reaching out for help. And I know some recent data has come out and has been in the news about, over the past 20 years or so, we've seen something like 214% increase in people being hospitalized for eating disorders and something like a 400% increase in hospitalizations for boys and men. So definitely seeing those numbers going upwards?
COVID-19 definitely had a effect on the rate of eating disorders in the public. So we did see a big increase after COVID-19, but I think as well, we just see an increase in eating disorders overall.
My name's Anita Federici. I'm a clinical psychologist in Ontario, and I have an adjunct faculty position at York University, and I run the Center for Psychology and Emotion Regulation, which is a private clinic that specializes in eating disorders treatment, trauma, and difficulties that people have with emotion regulation. They're definitely not a choice. Nobody says, I want to have bulimia. I want to have ARFID. I want to have, these are awful illnesses. They really are. You don't choose that you have metabolic differences. You don't choose that you have sensory differences. You don't choose a lot of things about your, the way that your brain works. You just don't. The science to date says that, there has to be some underlying genetic factors that make some people more vulnerable. Because you say, well, why doesn't everybody have an eating disorder, especially in North America, right? We're all exposed to toxic diet culture. We're all exposed to, significant invalidation around our bodies and food. You think everybody would have an eating disorder, but they don't. So they say, well, why is that? Some people say, well, it's because of trauma, and trauma plays a very big role in eating disorders. And not everybody with trauma has an eating disorder, and not everybody with an eating disorder has trauma, right? So there's there's not these clean lines between what causes what. So we know that in order to develop an eating disorder, there is some underlying biology. One of those, as we talked about, is we're learning more about metabolism, right? Metabolism is responsible for how you digest food, how you experience food moving through your body. Now think about eating disorders. Think about how hard it is to eat. Now you think about if somebody has problems with metabolism, this starts to make a bit more sense, right? So that they have trouble digesting food, they have trouble processing food, they have trouble with energy expenditure, too much, too little. So we know metabolism plays a role. We also know that there are differences from a genetic perspective around even emotion regulation. So some people are just born and they're just more emotionally sensitive. And you have some people that are very rigid and over-controlled. They're very perfectionistic. They're they can almost be compulsive. They don't like taking risks. Again, you don't pick it. So there are differences in how people cope emotionally that are associated with vulnerability for eating disorders and other mental health conditions, just things like that. The other area that I find particularly interesting with eating disorders is the sensory and perceptual differences that people have. They may have oral sensitivities. We see this in ARFID. Some people have sensory experiences with their bodies. So I actually think people do literally feel their body shifting, changing in ways that people without eating disorders really don't understand. So I think that when people say, I'm scared to gain weight, I actually don't know that they're scared to gain weight so much as they're terrified of the sensation of what it's like for the body to shift and grow and move and change. So again, these are new areas, but I do think there are sensory differences and perceptual differences. In the treatment, again, of ARFID, where we're seeing a lot of research happening right now, the researchers have been able to demonstrate that there are differences in hormone levels that regulate hunger and fullness cues. For this subgroup anyway of kiddos, they have elevated what's called fasting. So that when you're at sleep, they've elevated levels of a hormone that makes you feel full. There's just sensory experiences of I don't know if people can feel fluid shifts. I don't know what it is, but I believe 100% that for some people anyway with eating disorders that they have this almost like superpower to feel things, but it's also very uncomfortable because it means that you can detect noises, quote unquote, in your body that most of us probably have too, but just maybe ignore or don't even pay attention to. You're like, yeah. Whereas I think when you have an eating disorder, it becomes magnified and so it can be really invalidated when people say it's just the eating disorder or just push past it. It's like, well, It's part of how your body works. Neuroscience is there's a phenomenon called Alice in Wonderland syndrome. And it's been studied in people with epilepsy, migraine, and certain brain injuries. And it's a particular part of the brain that gets injured or impacted that actually changes the way people experience their bodies. They'll actually feel their bodies growing and shrinking. So when I saw this, I thought, this is fascinating, right? Is it possible that people with eating disorders also have some version or something like this? Again, I don't know. I've never been able to do a study like this, but I was looking at the brain regions implicated in eating disorders, and it's the same brain region related to Alice in Wonderland syndrome. I think social media has become such a big player and influencer. Social media doesn't cause an eating disorder. We know eating disorders are much more complicated and much more nuanced than that. But we tend to think of social media as something that can perpetuate problems with self-worth, social comparison, making people feel really lousy about their bodies and their appearance, and just generally feel like they're actually being left out of things. And so social media can have a significantly negative impact on people. Actually, one study showed recently that the longer that people spend on social media, not only do they feel more emotionally dysregulated, but they also feel worse about their bodies. So if you're somebody that's already vulnerable, let's say genetically or biologically, to developing an eating disorder, social media can really be a catalyst. Cynthia Bulick is a big genetics researcher in the eating disorders field, and she's famous. One of the things she's famous for saying is, genes load the gun, the environment pulls the trigger. It was her group that was able to demonstrate that, for example, people with anorexia have genetic differences in two chromosomes related to metabolism.
These are some signs and symptoms, but it's also important to keep in mind that folks will not experience all or any of these, but these are just some common signs and symptoms.
I think some of the earliest signs that we might see are things like that really intense preoccupation with your body or with food. And I think sometimes that can show up in looking like food guilt. So needing to justify what you've eaten, or feeling really ashamed after eating certain things. Food rules, I can't have certain foods. I only need to eat what's healthy. Cutting out certain food groups.
They think you have to look a certain way, or you have to be really, really sick. And the majority of eating disorders don't present that way. Most eating disorders, you could never tell by looking at somebody that they have an eating disorder.
You might notice that they're eliminating food groups, fearing weight gain, having certain rituals around food, so like excessive chewing, rearranging food on the plate. They might use a lot of condiments. They might also start drinking a lot of water or fluids to reduce their hunger. They'll avoid mealtime, and they'll also become more socially withdrawn. And then physically, they might start to experience difficulty concentrating, having stomach issues, dizziness or fainting, having issues with sleep, menstrual irregularities, thinning hair, and also cold hands and cold feet.
There's the physical health stuff, there's the mental health stuff, and then there's your social life and your day-to-day activity.
Eating disorders affect basically every organ system in the body. And for some people, these illnesses can be fatal. We know that eating disorders have the second highest mortality rate amongst all mental health conditions, just behind opioid use.
It's like the brain affects the eating disorder, let's say, but then the eating disorder affects the brain, right? So if you are in a malnourished state, yes, your brain is going to be impacted. Your whole body, there's not an organ system in the body that's not impacted by an eating disorder. The brain literally shrinks. You can lose gray and white matter. There are even studies, functional MRI studies of the brains of people, let's say with anorexia versus someone without, same age, same sort of. The brains of people with anorexia can look like advanced stage Alzheimer's disease. The good news is that with refeeding, you can reverse a lot of that loss and damage. So that's always a good thing.
You know, it can eat up your capacity to think about other things and eat up your capacity to cope with the things that are going on in your life. Spending time with your friends or being present with your family can be challenging when you've got, you know, food and your body on your mind at all times. It can be harder to engage in schoolwork if you're not nourishing yourself properly, or engaging in hobbies like sports.
Eating disorder puts you into survival mode. The brain just knows that you're malnourished in some way. So your brain's going, shoot, like we don't have enough food, slow down the resources. It's almost like an inside out thing, right? It's like, listen, slow down the heart rate and the metabolism, grow some fine hair along the body, keep this organism warm, right? There's this kind of way that the brain is so smart. It means that you're not going to be able to be playful. You're not going to be able to be, as socially connected, because all resources, whether you realize it or not, all resources are going to either finding food, navigating hunger and fullness, keeping the organs warm enough so you're okay. And you don't feel a lot of that stuff.
First, the cardiovascular system. Know that when people consume fewer calories, that means that the body breaks down its own tissues to use for fuel. The muscles are some of the first organs that break down, and the most important muscle in the body is the heart. So the risk for heart failure rises as the heart rate and blood pressure kind of sink lower and lower. Purging and vomiting by laxatives depletes your body of an important chemical called electrolytes. Potassium plays an important role in helping with the heartbeat and muscles contract, and that's depleted when someone purges. The next system is the gastrointestinal system. So we know with food restriction and purging by vomiting, that interferes with normal stomach emptying, having blood sugar fluctuations, feeling full after eating only a small amount of food. Neurologically, means that the brain is not getting the energy it needs. That can lead to obsessing about food and having difficulties concentrating. The body's neurons require a protective layer of lipids to be able to kind of conduct electricity. When there's an inadequate fat intake, that damages that protective layer, and someone might experience numbness, tingling in their hands, feet, and other extremities. The last kind of system is the endocrine system. You know that the body makes much needed hormones with fat and the cholesterol that we eat. So without enough fat and calories in your diet, levels of hormones can fall. So that means lower sex hormones, which can cause menstruation to stop or become irregular. It can also increase bone loss, so osteoporosis, which increases the risk of broken bones and fractures. And then without enough energy to fuel metabolic system, the core body temperature will drop.
So if we're looking at kind of strictly medical resources, you have hospital-based programs. And this is sort of a tertiary care model. So you have inpatient treatment programs, which are live-in programs that are centered around medical stabilization and returning a person back to a sense of stability. Then you have intensive outpatient or day hospital programs. These are programs that, you're medically stable, but you still need more intensive support. And so you might be going to appointments with your team on a pretty regular basis, 4, 5, 6 times a week. And then there's outpatient, which is usually offered in a group format, still with a multidisciplinary team, and maybe 1 or 2 appointments per week meeting with your team. And those are usually based out of a hospital, and they're covered by OHIP or provincially funded healthcare. A majority of the treatment options in Canada, though, however, are fee-for-service. So if you're working with a private therapist or a dietitian who's eating disorder informed, those are options as well. And then you have community organizations like NEDIC. In the GTHA, you have places like Sheena's Place that offers free support groups, or Body Brave that offers a self-guided recovery support program.
It's a big debated term in our field. So the idea of what constitutes recovery or remission isn't actually widely agreed upon. We're trying to get there in the province, but there's a lot of debate as to what that looks like. So from the perspective of BANA, we think recovery is like a lifelong journey. Right? It's not necessarily something that we're free from and we never have to think about it ever again. It's more maintenance, and there's naturally going to be times that it's more evoked and triggered, and it's more active, and you have to work on your recovery a little bit more actively. And then there might be times where it's very stagnant and mild, and you don't really have to put much thought into it at all. So when we think about what recovery from an eating disorder would look like, in terms of diagnostics and official, we'd be looking at, full remission from the symptoms in the DSM, the diagnostic manual. So usually what we're looking at is about a 3-month period where symptoms are either regressed, so a lot less frequent than what they were initially. So that might be a partial remission diagnosis, or they've had all of these symptoms absent for about a 3-month period. So that would be a full remission diagnosis. But I think recovery from an eating disorder is really working to maintain a positive relationship with one's body and treating one's body, in a really mindful way. Right? Meeting our body's needs, doing what we can to overcome urges of self-harmful behavior like binging or restricting, right? And also, I think it's just a matter of practicing, right? I don't know if we need to believe it in order to practice loving our body.
I struggled with an eating disorder throughout high school and a bit in my first year of university. Both times I kind of got fed up and tired with it and went to my parents for help. So I have been in recovery ever since I went to my parents for help in my first year in university. And through that recovery process is how I met our president, Cami, who wanted to start the Recovered Project. And we've been kind of working with each other for about 2 or so years now. And yeah, we've kind of taken off from there. I think a lot of it, to me at least, looked like being surrounded by my parents trying to help out. I did go to them and I did ask them for help. So a lot of my recovery was being at home, talking with them, working things out. And I think one of the most difficult things for me, was one, being honest about what I was going through and being honest with them about what bothered me, what I was thinking. And 2 was breaking out of the habits I had got into because of my eating disorder. So kind of like I mentioned, part of breaking out of that meant moving back home from university to live with them for a little bit and kind of breaking that routine I had created for myself while I was there. So I had gotten into this very eating disorder oriented routine where it was absolutely ruling my life, and moving home kind of meant almost I was like living under my parents' schedule, and I was very much breaking those habits that I had gotten very used to. I think it was a little bit of a joint effort between my friends and my family and myself. I always like to kind of contribute my family and friends as a big factor to my recovery. If I didn't have them, I don't know necessarily what I would have done. My parents especially were big parts in kind of helping me distinguish between what was good for me and what wasn't. And I really appreciated the fact they were always honest with me throughout recovery. If I was kind of having a day and I was saying things that maybe were more eating disorder oriented, they were very quick into just coming out and saying, nope, that's not how it's going to go. This is how it's going to go. We promise it's kind of for your better. And then kind of like I mentioned a little bit of myself as well. It took me quite a while to recognize that I very much had a big part in my healing and in my recovery. And that's something that I should kind of be proud of and recognize in myself.
This idea of approach recovery without an end zone in mind, right? Trying to approach recovery with curiosity and almost like you're going to experiment, you're going to explore. Go into recovery with the expectation that symptoms will pop up from time to time, even after they've been absent for a long time. And that doesn't mean that you're failing. But I think what's really important to note about eating disorders is the secret nature. And, because of that shame, a lot of people will try to keep their symptoms private, or they won't talk about it, right? They might avoid talking about it. So when someone's in eating disorder treatment or recovery, they're actually facing something that they're normally trying to avoid quite actively. So there is, unfortunately, a lot of discomfort and distress that comes with recovery. It's not, people look forward to coming to our sessions and they feel really happy and uplifted. It is hard work, and it does encourage people to go to places that are uncomfortable. But part of recovery is learning to tolerate that discomfort, right? So emotions around eating disorders can be quite powerful, because distress intolerance is seen as one of the roots of eating disorders, right? The inability to handle discomfort and distress. So it can be a very overwhelming place for someone to be. And I think it's so important that the people around us, going through an eating disorder recovery are at least in the know about how uncomfortable it can be.
Geographically, where you live may also impact your ability to get treatment. But some treatment facilities also have specific criteria, such as like BMI. So if that's not met, someone might not be able to get the higher level of treatment that they were recommended. And then lastly, I would just say the general stigma associated with eating disorders, because we know that many may not even reach out for help to get treatment that they need. So I would say that in and of itself is a barrier that people face when it comes to accessing treatment.
One of the major ones I would say is cost, because a lot of treatment options are private. Our government doesn't, OHIP doesn't cover private therapy or support with a dietitian. And so a lot of that is coming out of people's pockets, and, that can be really unaffordable. And I think when we're looking at provincially funded stuff, there are extensive wait lists across the board. And so if you're struggling with an eating disorder, you need help now. You can't afford to wait for, 5, 6, 7 months for your name to come up on a wait list.
Some of the recent statistics, and this was sort of during the COVID years, so I'm hopeful that this is changing, but I don't have the most recent stats. But generally, it would take between 7 and 10 years from the onset of the eating disorder, so when you first have symptoms, to getting actual evidence-based eating disorder treatment, 7 to 10 years. So the question about why should people care, why should people be educated, we need to close that gap. The longer somebody goes with an eating disorder, the harder it can be to change these behaviors that become so entrenched. We want people to be healthcare providers, for sure, to be educated so that they can detect it and act more quickly and get people into the treatment that they need faster. So that's one part of it. Just in the more general public, more awareness leads to, I think, greater compassion. There's it also helps us counter diet culture. So if I think about teachers, I think about parents, I think about siblings. When you understand how awful it is to have an eating disorder and how eating disorders develop and show up, I think it helps people be a bit more sensitive to differences in how people experience bodies and how people experience food. I think if people knew that they could talk to other people without feeling judged about their bodies, they might actually talk to people sooner. So I think we all become a healthier society when we can talk about what's going on and know what's going on and respond effectively.
I think being educated on eating disorders can help you sort of spot the signs, whether that's in yourself or in your loved one.
We know that for a lot of people, going to the primary care doctor is the very first step that they're going to take. And since many doctors may not be as educated on eating disorders, they might be dismissive or say or encourage harmful behaviors. So it's crucial that doctors be informed.
What we know about the medical field is there's very little on eating disorders in their curriculum in medical school. I would love to see the medical field have the education around restriction and dieting, right? Because time and time again, I've got a client, let's say, with binge eating disorder, and they have tried every diet and they have tried to lose weight more than anyone on our roster. They don't need to be told that they're living in a larger body. They already know. They also don't need to be reminded that they need to diet and lose weight all the time, because they've probably been told that by every professional and loved one in their life. So not only that, but telling this person to diet might actually be causing their problems, right? We know that one of the number one causes of binging and overeating is undereating and restriction, which often looks like dieting. For the general public, I think I would say the same thing, right? Is maybe learning to lean a little bit away from diet culture. I would love to see our community, our medical field, the public more and more and more aware of what's happening in their bodies physiologically when they're restricting. Right? So I'm going to drop a term here that I would love the world to go and research, which is semi-starvation starvation syndrome. That term is really relevant in treating eating disorders. And I'm going to leave that term there in people's heads to percolate and to try and draw that connection themselves. Like, why is that such a powerful term that we need to know when we're talking about eating disorders?
Part of the importance of advocacy and things like that is raising awareness of what one could possibly look like in someone. And I think with that, then other people are so much more likely to recognize it in someone around them or someone they care about. And with that information, even just with that little bit of kind of knowledge in the back of their mind, it can possibly encourage them to reach out and help that person or encourage that person to get help or anything like that.
There's nothing shameful about an illness that you didn't choose to have, but I think I have a lot of respect for people who say, yeah, this is something that I have and I'm working on, or because I think that breaks down barriers.
Mostly because I remember feeling so alone and scared at the thought of recovery. It was so intimidating. And I don't want other people to feel that way. So if I'm out here helping to raise awareness and helping people, then I can maybe help at least one person feel a little less alone. And at the end of the day, like, if I can help one person, then I feel like I've done something.
When we talk to people about this stuff in sort of our community education program, we kind of describe an eating disorder like an onion. And so the layers on the outside are food and body, but as we peel back the layers, we get to the core of it and what's actually underlying it and what's driving the eating disorder or what's keeping a person stuck in it. And these perpetuating factors are really big, hard things to unpack. So things like, if you're experiencing food insecurity, it's not easy to have a good relationship with food. Your eating disorder might be a way for you to cope with trauma, and you don't have any other strategies in place or supports in place to help you cope with that trauma. There's a lot of factors, beyond just food and eating and saying, just eat. There's a lot of factors that keep a person stuck in an eating disorder that I don't think are readily apparent to folks that aren't having these conversations.
One of the main things that I think about is, in the moment, it felt isolating. I felt like I was alone in my experience, and it was also just exhausting. I was tired of fighting with myself all the time and kind of tired of my mind being torn between doing what was good for me and what my eating disorder wanted. I think it kind of took me away from the things I loved as well. Like I mentioned, I was very tired of this all, so I became even not just emotionally or mentally tired, but physically tired. I was way too tired to do the sports that I loved, and I was way too focused on food and other things that, like, to hang out with my friends. So, and even when I did hang out with them, I didn't even feel like I was fully there. I felt like my mind was off worrying or focusing on the things it shouldn't be, rather than just trying to be in the moment with my friends and enjoy their company. I think now that I've gone through recovery and I'm in a healthy place and I'm out here with the Recovered Project helping people, it feels almost like empowering now in a sense. It feels like I've taken this kind of, for lack of a better word, like crappy hand I was dealt, and I've started turning it into something good. As much as I like to turn back the clock and take it all back and get rid of it, I kind of look back and I think, if I didn't go through this, I wouldn't be doing what I do today. And kind of like looking at the silver lining in it, in a sense.
From a perspective of inclusion and diversity, we definitely lack care pathways that are accountable. What does it mean to really be anti-oppressive? What does it really mean to be gender affirming and not just say you are, but what does that really mean on the ground? I don't think there's enough prevention. We've been talking about this, like the fact that most doctors don't know about eating disorders, speaks volumes. There's also prevention not just being for youth, but prevention regardless of where you are in the spectrum and age.
Right now, the province is funding prevention initiatives, which again, isn't really happening anywhere else in the world where the government's funding prevention. And BANA is one of the host organizations for our prevention specialists. So what that means is the province is paying people to go into schools and talk to teachers, to go into medical curriculum and change the medical curriculum and work towards preventing eating disorders in the first place. Like, we're actually paying people to go and target that and do that. So that's actually currently underway. That's about a year. I mean, it's been under development since 2018, I'd say. It's called the EDOP, but it's really, really exciting time for us right now because nowhere else in the world are we really seeing this. And it's going to get to the root of the issues that we've all identified.
There's also major gaps in terms of support for people that just aren't responding to the traditional eating disorder treatment. I don't think that there's only one or two treatments that are going to work for everybody. We also need more support. I think more harm reduction supports. I think that there need to be care pathways that emphasize quality of life, harm reduction for people at different places and stages. We also lack peer support. The field has always been dominated by beliefs that if somebody has an eating disorder, they can't really help other people. There's sort of a sense that people that have lived experience are unreliable, or, which I do not believe. But I think the field has suffered because of that.
So I'd say that it's super important that we continue to fund research, educate through awareness and advocate for change in different sectors of society, like schools, government, medical and mental health communities.
Again, I would like to see more valuing and more emphasizing or centering the experience of those that have historically been left out. Whether that's from people that have been oppressed, people that are marginalized, people with living experience.
If I'm saying, I'm not commenting on somebody else's eating, so how is that going to impact them? Well, people internalize this, right? How you talk about yourself and your own body and your own eating, someone might think, well, if that's how you think about yourself, how might you be thinking about the people around you? Right? Most people don't know why diet culture can be so harmful. So that just goes back to some of those earlier questions of how important that is. But I also think if we're that stumped with coming up with something else to talk about in our break room lunch tables, that's a problem. That right there is a problem if we can't come up with something else to talk about.
Opening the door up for a compassionate conversation to say, hey, I've noticed these things and I'm feeling really worried, and not trying to shift the blame onto the person that's affected or the person that's struggling, saying, I've noticed X, Y, and Z, and I'm really concerned. Do you want to tell me more about that? How can I support you? And I think in entering those conversations for family members or friends, I think it's normal to expect some resistance or some denial at a certain level because, eating disorders do thrive in secrecy and shame. And so holding space for that and holding compassion for that and letting a person know you're there for them when you want to talk. Coming into those conversations with resources prepared. So saying, hey, I know about NEDIC. They're an anonymous service. If you did want to talk to somebody about it, this is their number. Feel free to reach out. Or, hey, I know of this place called Sheena's Place. They do free support groups for people 17 and older. Maybe you want to check out something there. Or, having something prepared to hand off to them and say, if you don't want to talk to me about it, here are some professionals. Here's an anonymous place that you can go and talk about it and ask questions.
Really, I think one of the most powerful ways that you could support a loved one is by being mindful of language. No more commenting on how much someone's eating or what they're eating, right? No commenting on whether they've gained or even lost weight, right? Just doing your best to keep food and body commentary at a non-negotiable. We just don't talk about it anymore, right? It's a weird concept to grapple with because we talk about it so often. I mean, go into a break room at work and that's all people are talking about is like what diet they're on and like how much weight did you lose? And I got this many steps today. But that inherently has been identified in literature to be really problematic societally for eating disorders. So one very powerful way, I think, is to cut that language entirely and try to do what you can to, not comment on what people are eating and what their bodies look like.
Also say being a good role model for someone during the healing process. So basically what that means is examining your own personal beliefs and attitudes and prejudices and behaviors around food, weight, body image, physical appearance, health, and exercise. So identifying any unhealthy attitudes that you might have coming from dieting, weight stigma, the drive for thinness, and body dissatisfaction, just so you can kind of avoid perpetuating those harmful beliefs, which can contribute to disordered eating and body image issues. Support is a critical part of someone's recovery, I would say. We know that eating disorders can leave people feeling isolated and withdrawn. So when someone is not in session or in treatment, having a support system to rely on is key. What I often think of is like, if some find it helpful to have someone with them during meal times. And we also just know that the incorporation of loved ones in treatment itself can be helpful for recovery too.
Yeah, absolutely. I think full recovery is totally possible. And in saying that, I don't think that means that relapse is necessarily a bad thing. I think throughout periods in our life, we can have that sort of backsliding and slipping back into old eating disorder habits or thoughts, especially around key stressful moments. And I don't think that's a sign of failure. I think that's a sign that, something's not working right. And maybe this is an opportunity to reflect and change how we're doing things. And that being said, I don't think relapse is something that everyone experiences. I think it's totally possible to have a full recovery where you're able to leave those thoughts behind and leave those feelings behind and not ever engage in eating disorder behaviors throughout your life.
So I do believe that full recovery is possible, specifically with specialized treatment and support. I will say that we know that recovery looks different for everyone and has a different timetable.
Because sometimes people say to me, so I'm destined to be this way. I said, no, that's what's great about the brain and the body. You are sensitive to certain things, right? So you have to learn how to structure your environment and life so that you're not vulnerable. I don't define recovery ahead of time. Like a lot of people say, well, recovery has to be this or that. I say, I don't know. I think I have to meet people and sort of, who are you? What is it that you want in this life that you have? And what would we need to do to get you there if that's what you want to do? And sort of we co-create what recovery is.
Advocacy is such a powerful term. I always encourage my clients with lived experience to do it. I think one way that we can be powerful is by targeting policy and policymakers, right? So, I always encourage folks to look up their MPP in their local area and send off an email. And all that email has to say is more funding for eating disorders in Windsor, Essex, right? The more that we have that data coming into politicians, the more they're going to vocalize that, right, to the province, to the federal government, and the more we might see that funding trickle down to take care of these issues, right, from the ground up.
One of the biggest impacts you can make on someone's life is checking in. So if you're worried about someone, check in on them. And realistically, if you think about it, the worst thing that can happen is they're okay, and you've essentially just shown them that someone cares about them.
So, if you have lived experience, your voice is incredibly powerful, especially right now in this field as we're advocating for change and more research. So connecting with the National Eating Disorder Information Center, NEDIC, it's a really great resource and a tool. There's a lot of lived experience on that website, and they also engage a lot of activities and charity and awareness and education, and they have a helpline. So I think if you're looking to get involved or to support the field of eating disorders, NEDIC is a really great resource to help guide you through that.
A lot of what we do at NEDIC is helping people navigate the system. And so, if you're looking for treatment options or you don't know what's available, you don't know how to get help, that's what we're there for. We're staffed 7 days a week. And it's completely anonymous, free, and confidential.
In terms of the Recovered Project, we do have like a few programs and things if people are looking to help out. We have an ambassador program. We have a card project, which I think is a very unique thing. It's where board members or community members or anybody who essentially wants to help out are able to make kind of cards with motivational messages, affirmations, and things like that. And we take those cards and we send them to patients in eating disorder treatment to kind of give them a little boost or a little glimpse of hope or something like that.
And then I would also just say sharing that education in your own space, right? So if you've got a workplace with a diet culture break room, what can you do about that? I've had clients that will print off an article and just leave it on the break room table and not say who put it there. Right. And just to kind of observe, how do people take that? How do they talk about it? Right. Just putting those little question marks above their head. Or I've had clients who've made posters, this is a no diet talk space, right? So things like that in your space. So BANA right now, we have the outpatient program. So we treat clients with mild to moderate eating disorders who aren't medically compromised. And then we also have an intensive outpatient program right now that's servicing Windsor, Essex to Chatham. And so that's a relatively new program. I believe it's about 1.5 years, maybe pushing 2. So if folks didn't know about that, they're welcome to reach out to our centralized intake. Windsor, Essex is one of the only places in the world that has a centralized intake phone line, which means if you're wondering about eating disorder treatment or supports, there's one phone number you need to call and they'll direct you in the right space. So rather than trying to navigate the network, in the system by yourself, we have this centralized phone number.
Your illness is valid no matter what. No matter if you've been struggling for 1 week or 3 years, if you've been hospitalized or not, or even if you've never been officially diagnosed, you are quote unquote sick enough from the moment you start struggling, and no matter what, you will always deserve help.
I think if people knew that they could talk to other people without feeling judged about their bodies, they might actually talk to people sooner. So I think we all become a healthier society when we can talk about what's going on and know what's going on and respond effectively.
If we're not asking those questions about our relationship with food and body, it keeps our experience in the dark. I think starting that dialogue can open up doors to getting support. Despite those sort of negative things and those things that can make accessing support and treatment hard, it is available and it is out there, and things do absolutely get better.
And I've never met somebody for whom I felt it was completely hopeless. There was just no, I've just never met that person.
It's so important that the people around us, going through an eating disorder recovery are at least in the know about how uncomfortable it can be.
So I'd say that it's super important that we continue to fund research, educate through awareness and advocate for change.
I don't choose everything that happens to me, and I can learn something. No life experience is wasted,
I started this video for a school project. However, it did not end as such. In fact, there were times where I couldn't stop thinking about the project, who I wanted to contact, and what I wanted to do next. I was so excited because I want to see meaningful change for eating disorders, the way that they're researched, treated, diagnosed, and perceived. I hope that this video gives someone hope for their journey, that it will allow someone else to feel better able to support someone with an eating disorder, that it will spark conversation or inspire someone else to create change, and that most importantly, you have learned something from this video.
Eating disorders are serious illnesses
that require compassion, understanding,
and treatment, and I believe that education and awareness
are the first steps in creating change.
We need to reconsider our beliefs and opinions on eating disorders.
We need to use our voices to speak up and create awareness so that fewer people will suffer from the illnesses and go without treatment.
Thank you to everyone who participated in this video, as well as those who are not featured in the video, but who offered their support and knowledge along the way. You have inspired me to create change, and you have all played a vital role in helping this project come to life.